Hey everyone, welcome back to Wellness Wisdom. Today we're diving into some of the most common questions I get from my patients about sleep. We all know how crucial a good night's sleep is, but how much do we really know about optimizing it? In this video, we'll be covering everything from how long you should actually sleep to the role of diet and exercise in improving your rest. We'll also explore the best sleeping positions and other key factors that influence sleep quality. I'll be sharing tips on how to create the perfect sleep environment, including whether pets should share the bed and how co-sleeping affects your rest. We'll also touch on fabric choices for better sleep, the pros and cons of sleep medications, and even some of the longest recorded periods people have gone without sleep. Spoiler alert, it's pretty wild. So if you're ready to level up your sleep game, stick around. Let's get into it. Sleep duration and something called sleep latency, which is just a fancy way of saying how long it takes you to fall asleep. So what's considered normal? Well, it typically takes about 10 to 20 minutes to fall asleep after you lay down. This time frame is referred to as your sleep latency. If you find yourself falling asleep almost immediately, within just a few minutes, that could be a sign of sleep deprivation. Your body might be crying out for rest. On the flip side, if it's taking you longer than 20 minutes to drift off, this could indicate potential insomnia or other underlying sleep issues. Now, let's be real, our sleep patterns can fluctuate. Occasional variations in sleep latency are completely normal, especially after a stressful day or a big meal. But if you notice a consistent pattern of either falling asleep way too fast or struggling to fall asleep night after night, it's worth paying attention to and possibly talking to a healthcare professional about it. In this video, we'll also touch on how sleep latency ties into overall sleep quality and why your pre-bed routine, things like diet, screen time, and stress management can have a huge impact on how quickly you fall asleep. So let's get into how you could track your sleep latency and improve both how long and how well you sleep. Stick around. The connection between your diet and your sleep, what you eat, and when you eat it can have a huge impact on how well you rest at night. First up, let's talk about meal timing. If you're eating large meals right before bed, that could be a recipe for poor sleep. Not only can it make you feel uncomfortable, but it can also lead to heartburn and acid reflux, which is never fun when you're trying to relax. The general rule of thumb: try to have dinner at least 2 to 3 hours before bedtime. This gives your body time to digest, so you can head to bed without any discomfort. But what if you get hungry before bed? That's where a sleep-friendly snack comes in. A light snack, like a small portion of yogurt, a banana, or a handful of almonds, can be a good idea. Just make sure to avoid caffeine, spicy foods, and alcohol. All of these can mess with your sleep by either keeping you awake or disrupting your sleep cycles. There's also research suggesting that certain nutrients can promote better sleep. For example, foods rich in magnesium, like leafy greens and nuts, or tryptophan, found in turkey or milk, may help you fall asleep more easily. Meanwhile, refined sugars and heavy, greasy foods should be limited before bedtime because they can spike your energy levels and leave you tossing and turning. In this video, we'll explore how what you eat affects your body's natural sleep rhythms, and I'll share some tips on how to create the perfect sleep-friendly evening routine. So stick around and let's get started. Next is the relationship between exercise and sleep quality, two key pillars of health that are more connected than you might think. We all know that regular exercise is great for our overall health, but did you know it can also dramatically improve how well you sleep? Studies show that people who get consistent, moderate to intense exercise tend to fall asleep faster, sleep more deeply, and wake up feeling more refreshed. It's one of the best natural ways to boost your sleep quality. That being said, timing matters. While exercising during the day, whether it's a morning run, an afternoon yoga session, or an evening walk, can promote better sleep, late-night intense workouts might have the opposite effect. That post-workout adrenaline rush can make it harder to wind down and fall asleep. So if you're hitting the gym late, try to wrap up at least 2 to 3 hours before bedtime to give your body a chance to relax. But here's the good news: moderate exercise in the evening, like a light jog, a session of stretching, or even a calming yoga routine, can actually enhance sleep. It helps to relieve stress, relax your muscles, and even improve your mood, all of which contribute to a more restful night. In this video, we'll break down the best types of exercise for better sleep and share tips on how to balance your workouts with your sleep schedule. So let's get into it and learn how to move your way to a better night's rest. Believe it or not, the way you sleep can have a big impact on your overall health, comfort, and even how rested you feel in the morning. So, which sleeping position is best? Well, that depends on a few things. There's no one-size-fits-all when it comes to sleeping positions. Some experts recommend back sleeping for optimal spinal alignment, as it helps keep your head, neck, and spine in a neutral position. This can reduce the likelihood of waking up with aches or stiffness. Back sleeping may also help prevent acid reflux because your head is elevated above your stomach. But if back sleeping isn't your thing, you're not alone. Many people prefer side sleeping, which can be great for reducing snoring and might even be recommended for those with sleep apnea. Side sleeping, especially on the left side, can also aid in digestion and improve circulation. Just make sure to use a pillow that supports your neck and keeps your spine in alignment. Now, if you're a stomach sleeper, there are some things to consider. While it may feel comfortable initially, sleeping face down can actually put a lot of strain on your neck and lower back, potentially leading to pain over time. It forces your head to twist in awkward positions and flattens the natural curve of your spine, which can make for a less restful sleep. Now let's talk about something that might surprise you: temperature and your sleep environment. Did you know that your body's core temperature naturally drops as you prepare for sleep? This cooling process helps signal to your brain that it's time to rest. That's why keeping your bedroom cool is crucial for a good night's sleep. The ideal bedroom temperature is generally between 60 to 68 degrees Fahrenheit. A room that's too hot can disrupt your body's ability to cool down, making it harder to fall asleep and stay asleep. You might find yourself tossing and turning or waking up drenched in sweat. If your room is too cold, however, it can make it difficult to get comfortable and may even lead to muscle stiffness. But temperature isn't the only factor. Let's not forget about air quality. A well-ventilated room with fresh air can also improve sleep quality. Using fans or air purifiers can help circulate the air and reduce allergens, giving you a more peaceful sleep environment. If dry air is an issue, especially in the colder months, adding a humidifier can help keep your airways comfortable and prevent dry skin. Another pro tip: bedding materials matter too. Breathable fabrics like cotton and bamboo can help regulate your body temperature and wick away moisture, keeping you cool throughout the night. Now let's address a topic that I know many of you have mixed feelings about: sleeping with pets in the bedroom. For some people, having a pet snuggled up in bed brings comfort, reduces stress, and can even help with anxiety. In fact, studies show that for many pet owners, the presence of their furry friends can lead to better emotional well-being, which may contribute to more relaxed sleep. However, pets can also be a source of sleep disruption, especially if they're restless during the night. Dogs in particular are known for moving around a lot, repositioning themselves, or even waking up and walking around a room. Their movements can disturb your sleep cycles, causing you to wake up more frequently than you would otherwise. On top of that, body heat from pets can raise the temperature in the bed, which, as we just discussed, can affect your sleep environment by making it too warm. Cats, on the other hand, might be more independent, but they can also wake up in the middle of the night to roam, play, or ask for attention. While some pets are low-maintenance sleepers, others may make it harder to get those uninterrupted hours of rest. One potential compromise: consider giving your pets their own space in the bedroom, like a pet bed or cozy blanket nearby. This way, you can still enjoy their comforting presence without sacrificing your sleep quality. And now, let's talk about a concept that's been gaining attention recently: the sleep divorce. Now, don't let the term scare you. It doesn't mean your relationship is on the rocks. In fact, choosing to sleep separately from your partner could actually enhance both your sleep quality and overall well-being. So, what exactly is a sleep divorce? It's when couples decide to sleep in separate beds or even separate rooms to avoid sleep disturbances. If one partner is a loud snorer, a restless sleeper, or perhaps works night shifts, sharing a bed can lead to fragmented sleep for the other. Over time, this can contribute to sleep deprivation, irritability, and even impact the relationship's dynamic, not because of the relationship itself, but simply due to poor rest. For some couples, this arrangement can be a game changer. Studies show that individuals who struggle with sleep disruptions from their partner tend to experience better sleep and even better moods when they sleep alone. If you're constantly waking up due to snoring, bed movement, or different sleep schedules, the idea of separate sleep spaces might be worth considering. It's not about emotional distance, it's about protecting your sleep health. That said, if you're not ready for separate rooms, there are also plenty of ways to mitigate these issues without a full sleep divorce. You can try white noise machines, earplugs, or even an adjustable bed that minimizes movement transfer. Now let's dive into an important topic that many people turn to when they struggle with sleep medications. While these can be effective in the short term, their long-term use often comes with significant risks. Many individuals rely on prescription sleep aids or over-the-counter options to help them drift off, especially during periods of stress or anxiety. However, it's important to understand that relying on these medications for extended periods is generally discouraged. Why? Because they can lead to dependency, meaning you might find it hard to fall asleep without them. Moreover, long-term use can diminish sleep quality itself. While these medications can help you fall asleep faster, they often affect the sleep cycles, leading to a less restorative sleep. You might find that even after a full night's sleep, you wake up feeling groggy or unrefreshed. Some common side effects include memory issues, drowsiness the next day, and even potential interactions with other medications you may be taking. If you find yourself frequently relying on sleep aids, it's crucial to consult with a healthcare provider. They can help you explore alternative strategies for improving sleep, such as cognitive behavioral therapy for insomnia, CBTI, which has proven to be highly effective without the side effects associated with medications. In this segment, we'll also look at some natural alternatives that may help promote better sleep without the risks of dependency. These include herbal remedies like chamomile or valerian root, as well as lifestyle changes that can create a healthier sleep environment. So let's take a closer look at how to manage sleep challenges without falling into the trap of long-term medication reliance. Stay with us. Now let's talk about something that might surprise you: the record for sleep deprivation. The longest official record for going without sleep is an astonishing 18 days. Can you imagine? While this might sound impressive, it's important to understand the serious health risks associated with such extreme sleep deprivation. Sleep experts warn that going without sleep for extended periods can lead to a host of negative effects on both mental and physical health. Prolonged wakefulness can impair cognitive function, cause mood swings, and even lead to hallucinations. In severe cases, it can trigger more serious health issues, including heart problems, weakened immune function, and an increased risk of chronic conditions like diabetes. Because of these significant health risks, organizations like Guinness World Records have stopped officially recognizing sleep deprivation records. They acknowledge that the potential harm to individuals far outweighs any fleeting sense of accomplishment. It's a stark reminder that sleep is not a luxury, but a vital necessity for our well-being. Instead of pushing our limits, we should focus on developing healthy sleep habits to ensure we're getting the restorative rest we need. In our next segment, we'll wrap up everything we've discussed and provide you with practical tips for creating your personalized sleep routine. So stick around as we empower you to prioritize your sleep health. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more insights on technology and health. Stay safe and informed, and thank you for watching.
How long should it take you to fall asleep? 10 to 20 minutes on average. I know that was a quick answer, but the amount of time it takes to fall asleep is called sleep latency. Actually, if you just close your eyes and pass out immediately, that might be a sign of sleep deprivation. On the other hand, if you often lie awake for 45 minutes or longer before falling asleep, it could point to a sleep disorder worth discussing with your doctor, usually called insomnia. I said usually because it's completely normal to fall asleep quickly sometimes or to occasionally have trouble falling asleep, so don't get too worried unless a pattern emerges.